So we're going to close now with some final remarks from David Reddy, who you heard at the start, of course, who leads MMV, who's got over 26 years in different roles, including, of course, in the pharmaceutical industry, but now with MMV for a number of years and also on the board of the Coalition for Epidemic Preparedness, as well as Roll Back Malaria and Malaria No More in the UK. So please welcome David to the stage for his concluding remarks.
Andrew, can you please stand up here for a moment? So Andrew's saying to himself, how on earth am I going to get this on an aeroplane back to London? And it's a really good question, and there's a lot of really smart people in the room who might be able to help you with an answer. So, Andrew, thank you so much for the superb moderation today.
Thank you.
It was superb, and I think we should also thank Andrew just for the wonderful journalism, for the support that he's given the global health community. He's inspirational, an incredibly bright man, and when he needs to be a tough journalist, he can be one. I've experienced it. So, Andrew, thank you very much.
Thank you.
So I'd like to begin by saying a few words of thanks. And firstly, a huge thanks to all of the presenters and moderators today. You've done a superb job. It's been unbelievably inspirational. I'd like to thank also our donors and our partners. And just a comment on that, because sometimes the two are one. You heard from Ambassador Staley about a lot of the work that PMI is doing. And yes, they're a funder of MMV, but they're also partners in the field. They're also data generators. And so it's the same as so much of what's occurring in this area is that our partners, it's really multifaceted. I'd like to thank the people who donate their time to us, our board of directors, our ESAC and our APMAC, who do this selflessly. They provide advice, counsel, mentorship, and governance. And please just give a round of applause because they are so important to everything that we do. I just want to give you a flavor for what it's like at an MMV board meeting. Do you know the question that I get asked the most? The question that I get asked the most is, how can I help you? Now, I think that is the type of environment that we all thrive in. And I think as a partnership, we thrive in. And it's something that we constantly should be asking of one another. So that leadership and that demonstration that's shown at our board level, we need to make sure that permeates. I'd like to give credit to my colleagues at MMV, and I have to say that I'm incredibly proud to be able to represent you here. You're a really talented group of professionals, and you've done a wonderful job in bringing together the partners today, and I want to single out a few people, and I know it's sometimes not fair, but definitely Joya and Lindsay and the team who have supported you to put on MMV's 20th anniversary celebration. Thank you so much. Now, something that would go completely unnoticed by everybody is we've had a lot of support here from a commercial organization called Nucleus Networks or Meditech Media, and we have their director, Stephen Cameron, with us, but what people don't know is they've been working with us for quite a few years now on a not-for-profit basis, providing us their expertise that they provide to industry, etc. But for us, this could otherwise be unaffordable, and so we're extremely indebted for the support that they've provided us. Now, just a few thoughts, and these might not be well formulated in the way they come out, but a couple of us today have shown the same graph, and that is of 3 different scenarios of what malaria could be in the future, the road to eradication. And Hans Rosling, the late Hans Rosling, called himself a possibilist because each of those scenarios is possible, and it's all a matter of strategy. But at the end of the day, strategy is nothing but a fancy word for choices. So it's all about the choices that we make. And at MMV, we've recently gone through something of a strategic rethink, and we've made some choices. And the first choice is that we choose to pursue eradication because it's one of those possibilities. The second choice is that we're going to redouble our efforts to do it. Another choice is that we understand that in some of the toughest areas, progress is plateauing. But that if we make the choice to, and we focus on increasing access, both in terms of the number of people, but in terms of the populations, particularly young children, pregnant women, women of childbearing potential, who can access treatments, then we can set things on the right course. So one of the choices is to really invest more in access and delivery. In addition to that, there are other choices that we can make, and one of them is in bringing new drugs forward. And so a key choice is focusing on things that are really going to support elimination and eradication as we move forward. And that's bringing out simpler drugs, because in the environments when we're stalling, these are environments where it's really tough. It's tough to access therapy, it's tough to adhere to therapy. And so if we can bring forward simpler medications that actually relieve some of the burden of treatment, we can make more progress, and that's an area of focus. And furthermore, drugs with new attributes that can block transmission, that can prevent reinfection, so post-treatment protection, these will help us. And furthermore, we need to make a conscious choice to protect the gains, and that requires two things. It requires that we develop chemoprevention or chemoprophylaxis, and secondly, that we develop drugs that are active against resistant forms, because we know that resistance is a biological inevitability. And so these are some of the key choices we're making. And what's wonderful is looking out over all of you at the moment is that you're choosing to work with us and be part of this MMV family. And for that, we are incredibly grateful. And I ask you to make one other choice. And that choice is that today we saw the next generation of malaria leaders up here on the stage, and there are many more like them out there. And what we need is accelerated access to innovation, but accelerated access to the next generation of talent. And that requires that we invest in them. It means we invest our time, that we involve them in the decision making, because that inclusion will help speed their development and bring them forward as the next generation of leaders. So if we commit ourselves to that, we will have the type of future we are looking for, and that is a future free of malaria. So I'd like to thank you all. The last part of any family celebration is the photograph. And so at this point, a photographer is going to come up and they're going to photograph you. So please remain in your seats. They will give the signal afterwards, after which I wish you all a safe journey back. And on behalf of the whole of MMV, we thank you for everything you do day in, day out.